I'm Dr. John Epperly, and I'm here today to talk to you a little bit about viral upper respiratory infections. It's a common thing we see, especially between the months of October and March. And I think we wanted to make sure patients understand why we do what we do and how we treat people the way we treat them. I think at times people leave a little frustrated. They kind of think we've withheld a magic pill that can make them all better in a day or two by not giving them antibiotics. And I wanted to make sure that we clarified that today. Like I said, most of the times people have the symptoms of runny nose, cough, congestion, even a little fever and headache. 80% of the time these are caused by viral upper respiratory infections. So there are different kinds of viral infections, including adenovirus, rotavirus, etc., that can get into your upper respiratory tract and cause inflammation and give us the annoying symptoms we very commonly see. And because that's usually what we see, most people that come here with those kind of complaints don't often get antibiotics. And I wanted to make sure people knew why we don't give antibiotics. Number one is antibiotics don't shorten the course of viral infections at all. And that's the biggest thing. Giving people needless medication I don't think is a good idea. And here at New Hampton, we don't want to be pill pushers. We don't want to throw a pill at every problem, and sometimes problems don't need pills. And that's the really biggest reason why we don't use antibiotics for viral infections. And number two, when you do give a person a pill, there's always a risk of having allergic reaction or severe reactions. Of course, I always like to bring up this story when I'm talking to people. At one point, my son had an actual ear infection, and it was a bacterial ear infection, and rightfully so. He was put on an antibiotic called amoxicillin. Many of you know. He had a very severe reaction to this medication, and luckily it wasn't life-threatening, but it could have been. And so, for me, that's a big reason why I don't want to add an unnecessary risk to patients by putting them on a drug they don't need in the first place that could then cause harmful side effects. And then the third reason we don't like to prescribe them is really for the overall community health. As a lot of people have read about and a lot of publicity has been given over the last probably 5 or 10 years, we've started to have what we call superbugs. They're bacteria that are resistant to a lot of antibiotics. And the biggest reason for this is unnecessary and needless prescribing of antibiotics for viral infections or common colds. And this is, of course, a problem as we try to continue to come up with new medications, but there could be a time where we don't have enough antibiotics for certain bacterial infections. And so if we continue prescribing antibiotics needlessly, we might find somewhere down the line that we're going to have bacteria that we can't treat. And so I think it's important, as we look at the individual patient and as the healthcare in the community, that we don't cause problems with bacterial resistance. The other thing, I do think it's important often to see your physician when you have symptoms, because sometimes people can have a bacterial pneumonia or a bacterial ear infection or even a sinusitis that sometimes will benefit from antibiotics. So I don't want to say don't ever come in, because I think sometimes we do catch things that need antibiotics. But for the most part, 80% of the time, people just need some tender loving care. They need symptomatic treatment, most of which we can give you, you can pick up over the counter. And sometimes we can give you stuff even stronger to help with your symptoms. So I hope that clarifies the point, but we're not harboring a secret weapon or a secret pill that's going to make you better when we don't give you an antibiotic. We really are doing what we think is best for you and what we think is best for the community.